to be doctors. How's this mean? Got it. Okay, so the idea itself is really simple. It's a simulation that you would play on the computer, or it could possibly be transferred to mobile if you wanted it to. It's just, you are given a patient. A patient comes into your waiting room, and then the patient has a set of symptoms. And then you have to send it both to a lab setting, where you take different tests to try and figure out what's wrong with the patient. And also, after you figure out what's wrong with the patient, then you're sent to a treatment center, where you have to figure out what treatment would be best to treat what's going on with that patient. And it's just a 3-step process. And the reason that it's so simple is because we were planning on having it set towards more of a middle school age, like when you're first getting into your first real biology class, and you're learning stuff about how the different body systems and how they connect to each other. And if you're sitting there and you are like, okay, I have a pain in my leg, that's your symptom. You have to figure out, okay, maybe it's a problem with the skeletal system, maybe there's something wrong with your bone, maybe there's a problem with the muscle, maybe you just pulled a muscle. But there's also the possibility of maybe it's a problem with the nervous system, like maybe you have some pain in your nerves. So it can help the middle school age students learn how about these symptoms can connect to these body systems, and also how the body systems connect to each other.
From the graphics, we really thought that a simple kind of C# Visual Basic web application form would probably be the best, because it's just really simple to do, and it has the information laid out really easily. So it'd probably be the most optimized way to do it for now, at least. And well, this is just the base. This is how middle school or even elementary school, if you wanted to do it that far. It's just the simplest way you can do it. But also, if you wanted to, you could develop it more and give more specified tests and more challenging symptoms. And you could even get it up to a point where you could give it to a medical school, and then they use it as a simulation to try and decide what disease is it? What test is the best way to figure out what disease is it, and how you can treat this disease in a proper way. And everything that I basically already said, but and it's also to encourage students to become doctors. Right now we are actually on an upswing of a lot of people are going into medical school because they want to become doctors and they want to help people. But in the future, if we do end up having issues with that, because a lot of people get, lazy, or they just don't want to, or they're not interested in it, it's a way to get students that are younger to be more interested in becoming these getting into these medical fields, including nursing and being a doctor. And it could also be, if you wanted to, it could be applied to veterinarians and marine science and that kind of thing. And the relevance to biology, of course, is because we're trying to get the systems to work together. We're trying to figure out what symptoms affect what systems. It's basically a really simple way to get students involved, because it is more of a game, and it does have a satisfaction level where if you take too many tests, then your satisfaction level goes down, and then you have less points, all that kind of stuff. It's a challenge. It could be a competition. You put it in the science room, and you see who can get the most points, who can do it the fastest, and students will get more involved, people will get more motivated, and it's just a fun way to learn more about the body systems and learn more about being a doctor itself.
Questions?
Yeah.
Can you go back 2 or 3 slides to the example homework? That one? Yeah. Okay. I see at the top it says CT scan, MRI, and PET scan.
Yeah.
You're gonna give that to middle school?
No, it's just it's not you actually do that. It's just you saying and then we would also have a little, at the beginning you get info on what these tests do. And then you say
yeah, at least they're gonna get educate them, I guess, right?
Yeah.
That's all purpose. You educate them first, and then you test. It kind of let them play, let them play. So is this gonna be the platform? That's if I go and play, it's gonna be like this, looking like this?
Yes.
Probably going to be more
Yeah, because like, my deal is middle schoolers, that's boring.
They want to
Yeah.
see something.
I mean, honestly, you know how they are now. I mean, I'm not gonna play with that, you know, so, well, how are you gonna make this, you know, more probably?
Scene graphics.
Yeah.
Because like at the beginning, you know, we said like, kind of like the waiting room and it has kind of like the two doors.
Right,
adding
right.
into graphics.
So you will have those
So-
incorporated
Yeah.
and little movement here and there, okay.
Like, I don't know if you guys ever played like Pillsbury, like that one thing where it was kind of like three-dimensional, but not really, and it was kind of like the tilted. I kind of saw that as the waiting room, I don't know.
Right, yeah.
Did you make this for this?
No,
Okay.
yeah, this was just, I didn't personally.
Okay. Shane has a question. Yes, Shane.
Oh, that's it. Sorry.
Is it?
Yeah. sorry.
Okay, well, at the end of the semester, what are you gonna be able to produce?
We're definitely gonna have a trailer demo, but we're hoping to actually get a working demo also.
Huh? Awesome.
So we're gonna have like a
It's
video
not that
of the
difficult
demo,
then.
but we're
Okay.
hoping to get
Okay,
actual working demo.
that's good. All right. Thank you,